Hi, my name is Catherine Lopez, and I'll be talking about antiarrhythmics in PALS. So, amiodarone versus lidocaine. So, our objectives today are to define ventricular fibrillation, identify antiarrhythmics that are used during pediatric advanced life support, or PALS, and differentiate between lidocaine and amiodarone. So, what's ventricular fibrillation? Ventricular fibrillation is the most serious cardiac arrhythmia that leads to death if it's not stopped. The ventricles have cardiac impulses that are constantly firing and firing and firing, contracting and relaxing at the same time. So there's no way that the heart is able to fill or it's able to pump effectively. So when all of these impulses are going at the same time, there's no blood flow to the brain or to the rest of the muscles. So within 4 to 5 seconds of that happening, the patient actually goes unconscious and the muscles will start to die. And then actually the patient will die if it's not stopped. So in children, if anyone's ever been to PALS, they know that it's always emphasized that children go from a respiratory arrest to a cardiac arrest. Now in adults it's different. The adults can have some cardiac ischemia that can lead them directly to a cardiac arrest. But in children, it's respiratory to cardiac arrhythmia, to cardiac arrest. So the medications that are recommended for children are amiodarone or lidocaine. Now when I took PALS in January, the instructor said that you could use either amiodarone or lidocaine. But I told him as I did the pre-test, and according to the American Heart Association, lidocaine was recommended for children, and I wanted to know why. And so the other anesthesiologist instructor said that amiodarone was stronger and lidocaine was recommended for children, so it wouldn't be as strong. So I thought this was the perfect opportunity to differentiate what the difference was and why it would be better for children. So let's define an arrhythmia first. An arrhythmia is an abnormal impulse from the heart or an abnormal pathway from the heart so that the rhythm is not normal. Now, the antiarrhythmics that are recommended, there are different classes. There's class 1, which is our sodium channel blockers. Class 2, which is our beta blockers. Class 3 is our potassium channel blockers. Class 4 is our calcium channel blockers, and then there's other. Now you can see here that ventricular fibrillation is lidocaine and amiodarone are their recommended medications. So we're going to look at that, our class 1 sodium channel blocker of lidocaine and our class 3 potassium channel blocker of amiodarone. So lidocaine is the class B. Rapidly associated and dissociated from sodium channels. So since the cardiac cell is rapidly firing during ventricular fibrillation, lidocaine is effective. Now adverse effects can include drowsiness, slurred speech, agitation, paresthesia, and convulsions and confusion. Now amiodarone is a class 3 which blocks the potassium channels, and it also prolongs the action potential refractory period. So it's actually a very complex medication that has class 1, class 2, class 3, and class 4, and alpha blocking activity. So it's not only blocking off potassium like the other class 3s, but it's blocking off the sodium channels, it's blocking off the beta blockers, it's blocking off the potassium and calcium and the alpha. So it's a very strong drug. It's used for both atrial and ventricular fibrillation, and its adverse effects include pulmonary fibrosis, neuropathy, hepatotoxicity, corneal deposits, optic neuritis, and blue-gray pigmentation, as we'll see here. And then hypothyroidism and hyperthyroidism. Now, the cost they're all IV, so I was unable to find that. But now you see the adverse effects of lidocaine versus the adverse effects of amiodarone, and you think of a child. The child, again, as emphasized in PALS, the cardiac arrest happens because of respiratory issues. Only 10% of the initial rhythms in children are ventricular fibrillation. So knowing the side effects and knowing that that's probably not going to be the cause of cardiac arrest in a child, the best bet would be to go with lidocaine. So if you have any questions? Very good. Here's our references that we used. Thank you.